Good morning, Christy.
Good morning. It's nice to be here. Nice to see you.
It's nice to see you, too. Thank you for joining me.
Oh, you're welcome. Thank you for letting me join you.
Well, I'm always happy to have you here. Talking to myself is a lot less entertaining than having somebody to talk to. So,
when I talk to myself, it's not usually too nice. So
yeah.
It's nice to have a pleasant conversation.
Yeah, it is. Mm-hmm. It is. I think it helps keep this whole thing a little bit more grounded. So.
Yeah.
Well, welcome. Thank you very much for joining us today here on our Facebook live stream of Healing at the Speed of Light. Healing at the Speed of Light is our patient-focused podcast to talk about light and laser therapies. Today we're talking about veterans with traumatic brain injury, and we've got a really great research study that we're going to review, talk about what light therapy really is, what traumatic brain injuries are, how light therapy can work to help the symptoms of brain injuries, and exactly what that looks like. So thank you very much for joining us. My name is Dr. Jason Roundtree. I'm a certified medical laser safety officer and also a chiropractor. I've been doing laser therapy for a little while now, and we actually help to train other practitioners across the globe through Laser Therapy Institute. So if you're interested in finding a laser center near you, you can go to lasertherapyinstitute.org. I'm joined by Christy, who is a certified laser tech and has done thousands of laser treatments over the years. She currently is our VP of Content Development, which means that she builds all of our online training and a lot of our digital content for our members that are across the nation.
And I always have to say it's through his knowledge, through your knowledge and brains, that we are able to do that. And,
I can run
the
my
work
mouth.
you do
Well,
with the research, and so.
Thank you. But it's pretty easy for me to run my mouth, and it's a whole other thing entirely for somebody else to have to interpret it and do something with it. So, yes, I appreciate your work.
Well, I appreciate yours as well.
So let's go ahead and jump into this study. This is a really interesting study, I think, that talks about veterans with chronic traumatic brain injuries. It is an open study. If you'd like to read it, I'm going to give you the title right now. The title of the study is Pulsed Transcranial Red Near-Infrared Light Therapy Using Light-Emitting Diodes Improves Cerebral Blood Flow and Cognitive Function in Veterans with Chronic Traumatic Brain Injury, a case series.
And we'll put this in the show notes so that they can reread that.
Yeah, we'll give you a link you can just click, because if you have to type all that into Google there, that'll be a little rough. If you've seen The Office, the one scene where Michael Scott talks about a really good headline, and it just goes on and on and on and on and on. That's what this one felt like, but it is very descriptive too, so we'll break that down in a minute. But anyway, this was published in Photobiomodulation, Photomedicine, and Laser Surgery back in 2019. So really a pretty recent study, not the most recent we have, but this is one of our building blocks as we look at the possibilities of treating traumatic brain injuries with light. So just to break down that title briefly, let's go to the end of it. So it's a case series. A case series is not really like a double-blinded study, that you need to do for medications and things like that we really like to see for laser therapy studies. A case series is more like hey, here's some things that we did with these patients. We treated them this way, and here's what we saw. Okay. So it is not just the most bomb-proof study, but there's a lot in here that's really good. So definitely wanted to bring it around. The next piece up from the tail end of the title is chronic traumatic brain injury, meaning that it wasn't something recent. It's been going on for a long time. The next piece is they talk about cognitive function and cerebral blood flow. The cognitive function, of course, is how well the brain works, and cerebral blood flow is how much blood is getting to these different areas of the brain, right? In this case, they use light-emitting diodes, not lasers, but LEDs and lasers both produce very similar types of light. They can produce very similar types of light. Lasers tend to be a little bit more efficient for clinicians to use. However, there are definitely upsides to LED use as well, so not to put down LEDs at all.
Well, it's something that's more doable at home if that's something to be done.
Yes, very, very high-power lasers can be very safe, but they always have eye risks, as LEDs do not. So Right there, if you're going to be giving somebody something to use at home, an LED is easier to give them and know that it's going to be fine, rather than, like a $60,000 class 4
right.
super pulse laser. Yeah, exactly. The last bit of this title that we're still breaking down here is that they used red and near infrared light that was pulsed. So this is visible red, and then invisible infrared light, and then it was pulsed, meaning that they flashed it rather than just having it turned on steadily the whole time. Okay, so now that we've gotten through the title,
Phew.
let's get a little bit more information here. So what is a traumatic brain injury? A traumatic brain injury is when you have brain damage due to impact or blast. NIH says that it may or may not include loss of consciousness. Symptoms are headache, fatigue, dizziness, confusion, ear ringing or tinnitus, a bad taste in your mouth, sleep disorders, memory problems, recall, attention, so many things. Very, very, very broad amount of symptoms that can go along with traumatic brain injury. And in a lot of cases, each case is very, very different. Depending on the injury, depending on how long ago it was, how severe it was, and then the person's genetic makeup, which portions of the brain are damaged. I mean, you can have, 15 TBI patients sitting in front of you, and they will, every single case, be very different.
Right.
So.
Well, and the way the injury happened is so varied.
Yes.
So.
Yeah. So that's traumatic brain injuries. Now, traumatic brain injuries in veterans is a kind of more specific case here. So we'll go to the study here. They say the incidence of traumatic brain injury has grown over the past decade. Among returning soldiers, traumatic brain injuries have been recognized as the signature wound of the Iraq and Afghanistan wars. Rates of depression, anxiety, and psychological symptoms are markedly elevated in traumatic brain injury survivors. So we know that in a lot of cases, armored vehicles especially are more resilient to damage, and a lot of the folks that have been injured in these fights have been blast and concussion related traumatic brain injuries. They may not have a visible bleeding wound,
right,
but the blast injury can be very, very severe, even if somebody is partially shielded. And so we saw a lot of vets that were surviving things that maybe in wars past they wouldn't have, but they're coming away with some injuries now that that have some serious psychological impact.
Right.
As far as treatment goes, they say that current treatment for traumatic brain injury is focused on pharmacotherapy and cognitive rehabilitation therapy. They say the residual cognitive and psychological impairments from traumatic brain injury show minimal response to these interventions. So meds and cognitive rehab therapy, counseling, things like that. So not to diminish the importance of good therapy and counseling, but when you're working with brain damage, the brain has to work around damaged areas. So the very best you're going to get with some of these cognitive and medication-based therapies is some symptomatic adaptations in the brain, because you're not really addressing some of the damage. Some of the damage that we talk about really is decreased blood flow to different regions of the brain as a result of the impact, the scarring, and so forth. So that means that you've got physical changes that have happened in the brain that we're trying to address through things like anti-inflammatories and counseling. And those can be important, especially the counseling side, but we're not necessarily changing the damage to the brain. I can tell you've got a thought.
I do, but it's not formulating, so I'll just let you keep
Fair enough.
going.
Just interrupt me if it pops up. Yeah. So it is difficult to address and even to assess these changes in the brain. They go on to say in the study that photobiomodulation therapy, or light therapy, has demonstrated positive effects on traumatic brain injury in humans and animal models. And the way that works is fairly complicated. So hang with me for just a minute while I get somewhat technical, because if you want to know how completely non-invasive light is supposed to do anything, how shining basically a fancy flashlight on your head is supposed to do anything, this is the exact breakdown of what we think is happening. They say the postulated mechanism of action for photobiomodulation is the release of nitric oxide from hemoglobin in red blood cells, nitric oxide synthase lining the capillary endothelial cells, and cytochrome C oxidase within mitochondria, increasing adenosine triphosphate production, or ATP production. Nitric oxide both activates the cyclase to trigger vasodilation and stimulates angiogenesis through the process of photobiomodulation. Nitric oxide increases reactive oxygen species, anti-inflammatory molecules, and neuroprotective factors.
Phew.
Whew, you made it. Good job. So, those are the really, really fine building blocks approach here to what happens when you have light, which is an energy form, right? When you have light that is absorbed by these different parts of the cells, these are the things that happen. It stimulates more blood flow. It stimulates the building of new blood vessels. And when we're talking about traumatic brain injury, that's really how you fix traumatic brain injury. And when I say fix, of course, I'm not saying we're curing anything. What I'm saying is you're changing things back more towards the way they are supposed to be.
And I can just hear people listening say, well, how do you get through the bone? How do you get through the skull?
Yes.
And it does. I mean, the light does penetrate through the bone.
Yes. They actually say in here that near-infrared light in particular has been demonstrated to penetrate the human skull in multiple studies. So that may seem odd, but think about this. If you're in a dark room, you take a flashlight and you put it on one side of your hand, can you see light?
You can.
Absolutely, right? So that means that visible light is going through your hand, making it all the way to your eye so that you can sense it.
Right.
Now, near-infrared light is actually invisible light, which is weird to think about, light being invisible, but it absolutely is a very real light source. We just can't see it.
We just can't see it.
Yeah. There's some animals that can pick up near-infrared light. And there's cameras that can pick up near-infrared light, but you can if you get one of these near-infrared cameras, you can physically see like the near-infrared light going straight through the bone, straight through the tissues, which is
it's just so fascinating.
It's very interesting. Now, we're not cooking anything or
No.
heating things up at all.
No.
In fact, a lot of times there's really minimal heat or no heat with these photobiomodulation treatments. So that's not the action here. It's the actual light itself. Think about how your body will create vitamin D. It'll synthesize vitamin D from going out in sunlight, right? So we know light can do things within the body, and this is just the right kind of light,
Right.
directed in the right way to try and get this brain damage reversal.
Which is really fascinating, exciting, and what we're reading and hearing, it's absolutely possible.
Yes, and this is only one of dozens of studies. So
Right.
We'll be bringing more of these around. This is just the one we kind of settled on today. But there's a lot of studies out here. So this is just one example. Now, in this particular study, they took 12 veterans between the ages of 21 and 55. The minimum time since the last reported brain injury was 18 months. So they did that because they said they wanted to rule out that any improvement would not be attributable to the brain's natural healing process, which can occur up to 18 months following traumatic brain injury. So they didn't want to have that kind of the body's own recovery coloring the results.
Right.
That's not to say you can't treat people that are within 18 months of a traumatic brain injury. You can treat them anytime as long as there's not a bleed.
Maybe expedite the healing process.
Yeah, exactly.
Repair.
Exactly. But if it's been a year or 2 or 3 since a traumatic brain injury and you're still dealing with the symptoms and the problems of it, hope is not lost.
Right.
So I'll read on.
Please do.
In this case, I thought it was worth bringing a few factors about these particular 12 vets. There are multiple different mechanisms of injury for these guys. So, and they're all males, so I can say guys.
Okay.
But In this case, the traumatic brain injuries are spread out sometimes as old as 1985. Others more recent, and again, this study was in 2019. So some of these were very, very aged.
And that was going to be a question I had: is how long can you start? How long away?
Yeah, evidently,
Quite a while.
20 years, 30 years.
30 years.
So some of these guys had multiple IED blasts. One slipped on an airstrip and had a head impact with loss of consciousness. Several of them had football-related concussions, repeated concussions. There's mountain biking accidents, bull riding, several motor vehicle accidents, a high-speed boating accident, wrestling. All these, a lot of varied and different sources of brain injury. So not just one thing. One was a helicopter crash. I mean, there's just all kinds of things. So yeah, kind of a very a varied history on these guys and their actual causes of traumatic brain injury. So they pulled this history from these guys, and then they did a SPECT scan where they can look at the blood flow to the brain, and they used a radiologist and a neurologist to look at these scans and actually verify that these guys had brain changes associated with these traumatic brain injuries. So it wasn't just medical records or the participants who reported it. They were actually seeing the changes in the brain due to the traumatic brain injury. So what they did is they got these guys in and they treated them with LEDs in the red and infrared spectrum. They did 20-minute treatment sessions 3 times a week for 6 weeks, so a total of 18 sessions. And the light was a very, very low intensity red-infrared combo with a total of 7.7 joules per centimeter squared. So that's energy density delivered to the entire head, and they did the entire brain. Some studies only do one section, where they'll target just certain areas. In this study, they just did the whole thing. Average power density was 6.4 milliwatts per centimeter squared, which is very, very low. And the colors they used were visible red at 629 nanometers and invisible near infrared at 850 nanometers. And they pulsed the light at 3 different frequencies: 73, 587, and 1175 hertz. Those are, if you ever heard of Nogier frequencies, whatever that is, there's some kind of alternative medicine kind of frequencies. So I thought it was interesting they selected these with really no other studies that have been really done with those. But they wanted to go with pulse, and that's what they picked. My problem with that is that they did all 3 of those frequencies on all these guys. They didn't try, 1 on 3 and a different frequency on 3 others, or anything like that.
Just to see how it would vary.
Yeah, so we really don't know how this worked. Was it, would it have been better to have been constantly on continuous wave? Would it have been better at 2 hertz or 10 or 50? We don't know. We don't know if there's a difference between these frequencies either. So, but that's what they did. So 18 total sessions over 6 weeks, right? It took about 20 minutes to deliver. And then they also measured, of course, blood flow into the brain once they were done, as well as going through some of the neurological tests. So let me get to my page here. What they found is that all 12 participants achieved improvement in 14 out of 15 neuropsychological parameters, and 8 of the 12 demonstrated improvement in regional cerebral blood flow on the study. So, not a huge, not 100% of them showed that increase in blood flow, and the 14 out of 15 neuropsychological parameters, that is good, but it wasn't a massive increase in improvement. It was significant, but it wasn't quite what I would expect and look for. So very exciting. We got some improvement, especially in these guys who have had some brain injuries for over 30 years.
Right.
Yeah, so it's a big deal. So this is really exciting, but I think there's a lot more still that we're going to learn about how to deliver the best kind of treatment, what that really looks like, what kind of expectations we should have. But I think the takeaway here is that, using light therapy for brain injuries can truly change those brain injuries.
Well, and not just, you don't have to hit it immediately. If you realize over time that this is still an issue, that there is still hope, and you don't have to give up.
Yes.
Pursue it.
Yeah.
Why not?
Right.
Non-invasive?
It's non-invasive. There are no safety concerns here. It's completely safe. Just one quick story. We had a guy, must have been a couple years ago now, but he had a brain injury, and the doctors just kept going, well, you're going to get better. Just let yourself get better. You don't need to do anything. And about a year after the injury, he went in to get his checkup, and they go, okay, well, you're done. That's as good as you're going to get. And he was like, well, I thought you said I was going to get better. I said, oh, yeah, but now you're past that window. So this is just what you have. And he's like, well, why didn't I do something before? And they're like, oh, well, there's nothing you can do. And he was coming to us, and this is another 2 years down the road, and he had some great improvements. Had some very good improvements really rapidly.
Wow.
So just because somebody told you, well, you're hopeless at this point, just because it's been a year or 3 or 20 or 30 doesn't mean that things can't be improved. There's definitely a possibility for most people with brain injury.
It may not be 100%, but even improvement is good.
Oh, absolutely.
Why not? Yeah, there's hope.
Yeah. If you've got memory concerns or like attention and recall concerns, even a 20% change, improvement there, is a huge quality of life change for people that are suffering with this.
Right.
And especially since it can be pretty inexpensive and it can be done easily, and it seems to have lasting results as well. I mean, all that is really good to consider if you're thinking about brain injury and treatment. Do keep in mind, it's not one and done.
No.
These guys had 18 treatments over 6 weeks to see, improvements that were significant. And maybe they would have gone on to have even more improvements if they'd kept going. You have to stop the study at some point. But
right.
But that's kind of my takeaways. Definitely consider light therapy if you're dealing with brain injuries. And definitely understand that it will take some time. It will happen gradually, but that by the time you're 6 weeks, 8 weeks, however long down the path there, you should be seeing some good changes. You really should. And the folks around you probably should be seeing changes as well.
It's always worth a consult.
Absolutely. Absolutely. If you're looking for a laser therapy clinic, you can go to lasertherapyinstitute.org, click on the tab labeled clinics, and hopefully you can find somebody near you. If you're having trouble with that, send us an email, info@lasertherapyinstitute.org. We like to try and connect patients with light therapy providers because this works so well. Everyone deserves to have access to it.
Definitely.
Thanks for joining me.
Thank you.